Health and Well-Being in Late Life. That's Dr. Chatterjee's book, which was published sometime last year. And the book was launched by the Vice President of India. So I think that that's a great thing. And he's, of course, a doctor in AIMS. But I wanted to read something from the foreword, which is written by Dr. Chatterjee's professor. So I am just quoting. I am only quoting. So he says, this is a Dr. A.B. Day, who was Dr. Chatterjee's senior professor and guide. He says the complexity of health problems makes geriatric medicine the most difficult branch of medicine. Physical and socio-economic dependence of older persons raises the issue of long-term care, which is a medico-social issue like infant and childhood mortality. In place of rapid changes in function and structures of families in India, long-term care of older family members has become an epidemic-like situation. So long-term care is beyond the realms of curative adult medicine. We will now, of course, let Dr. Chatterjee take over the session, but I just thought I wanted to read that and tell you about the book that he has published and a little more now about him. He is a doctor from the geriatrics department of AIMS. So he's actually one of the first geriatricians in the country. And during the first wave, he went well beyond the call of a duty and took the initiative of serving cooked food to old age homes, slum dwellers, and migrants stranded amidst the coronavirus lockdown. He believes that education is the most important thing in our lives, and one should continue to learn no matter how old that person is. He's the author of Health and Well-Being in Late Life, a TEDx speaker, and the founder of Healthy Aging in India. And Dr. Chatterjee, thank you so much for coming. I know that you're busy. I've actually been trying to get him, ladies and gentlemen, to come to us for several months. But the last time I spoke to him again, I think in April, you had COVID then, right?
Yeah,
the second time you had COVID. So maybe you'll tell us a little more about everything as we sort of get into the session. So with that, over to you, Dr. Chatterjee, and thank you so much for being here.
Thank you, madam, and thanks to the audience for joining this session. I can say I learn from all of you, especially those who are senior citizen. I see patient and I learn from them and their philosophy of life, their way of life, their approach to life. My maturity is also, I will say, I'm much more mature than what I used to when I didn't join this subject. So that is really great learning from all of you. Before I come to the topic called polypharmacy, which you must be knowing it very well, because many of us are also taking a lot of medicine. I would say I'll not preach a lot, because COVID situation is like that. You have a lot of webinar, lot of teaching and preaching and discussion, which is too much, I believe. But few things definitely I'll stress, because I'm a geriatrician. I have to tell you this repeatedly. Number one is your physical health. Many of you have seen some, I will say, many of us have seen a lot of ups and downs in this scenario. We have lost, many of us has lost our near and dear also. Physical health is the first thing which we have to take care. So even if you don't go to park, which was your daily activity, you walk inside your home. Even your home is a 12 by 10 single bedroom flat or a rented house. You walk there, you take 10 steps at a time, you increase the steps, you count or you don't count, but you walk. So someone who is not walking at all, I'll request him or her to walk 10 steps at a time. Someone who is walking 10 steps, I will tell him or her to take 20 steps. And remember, there is no contraindication of walking. Until unless you have severe osteoarthritis knee, your knee is not at all supporting you. Even if a patient who is of heart failure, who has recovered from hospital heart failure, in during cardiac rehabilitation also we talk about walking. So walking is the easiest, doable, and a must exercise for all of you. So you are depressed, you start walking within the house. You are happy, you walk. You are singing, you walk. You are chatting, you walk. You are chatting over phone and you are walking. Fine, do that. So physical health. Next, related to your physical health is your diet. Diet has to be definitely a programmed diet. That means you are already very disciplined compared to our generation or our next generation. Baby boomers who are 60, 65 plus, they are actually very disciplined people. And so so do that. Your diet must contain more protein. So if you are 60 kg weight, if you are having 60 kg weight, you have to have uh, let's say 1.5 milligram, 1.5 milligram per kg, gram per kg body weight. So you calculate like 90 gram protein you need to take throughout the day. Protein can be for non-veg people like us. There are a lot of food which contains protein. If you are vegetarian, egg is a great source of protein. Please have egg. And no contraindication for egg. There is no theory, no study which told don't take egg if you have no problem, if you are not allergic to egg. At least egg white is the highest source of protein. So agar, if you can take 2 egg white per day, you are taking care of protein. For pure vegetarian, you take paneer, you take cheese, you take legumes, you take nuts. These are good source of protein. Dry fruits you should take. Oil, anything is fine. Take less oil. Try to reduce carbohydrate intake in the night, especially in the night, with or without diabetes. Take as much fruits you can take. There's no contraindication of fruits. Fruits is always better. If you are alcoholic, this is a very, I'll say, maybe in open forum, telling this is not very safe, but still I'll say if you are alcoholic, try to moderate that alcohol. You cannot stop or not regret. But yes, if you're a smoker, you have to stop smoking. And remember, if you stop smoking even at the age of 70, you will have the dividend. Right. Physical के बाद mental health. Uh, COVID, COVID has created a lot of mental health issues for anybody starting from my child who is 10 years old, my daughter who is 4 years old. On and off, she says that, Papa, I'm not feeling well. My mental health is not okay. Because आजकल के बच्चे बहुत mature है. She says like that. My mental health is not okay. So I have given her tips, and she is working on that. She is a good cartoon designer. Like so, immediately I try to tell her, you just draw that. What is your mental expression? So she tries to explain her mental expression through drawing. So you can write that. So regarding mental health, there is a tips for all of you. In geriatric counseling, we tell this to everyone. You need to write 10 things in your day. Every day you write 10 things what gives you happiness. Because ultimately happiness is everything. Everything is that. Whatever we do it for happiness. If you're not doing that, then you are doing some mistake. So write 10 things which gives you happiness. It may be chatting with friend. It may be watching news. It may be watching some complex serial. It may be reading books. It may be chanting. It may be anything. Do that. Retrieve your previous connections. Forget ego. At least COVID has taught us ego has no role in our life. Like today I'm talking. I don't know tomorrow I'll be able to talk, or I'll be living in this world or not. We don't know. So every time, every day we have to enjoy. And so at least at the age of 65, 70, 80, you forget all the ego and just connect with, retrieve your old connection. Maybe your school friend, maybe your ex-girlfriend, maybe anybody. You just talk to them, connect with them. Connection, when you interact with others with a positive tone, we share positive vibe among each other. So do that. Mental health, our mental health has to be fine. Do mental exercise also, because which I discussed a lot in my book. I'm writing another book on mental health, dementia. So maybe end of December that book will be completed. So point is, for brain there is a either you use it or you use it. Just like brain or muscle, the story is same. If you do this with your biceps with 1 kilo salt packet, your biceps will be fine, even at the age of 100 years. If you don't use it, biceps will be wasted or atrophied. Similarly, for brain muscle, if you don't use it, it will be wasted. Learn new skill, learn new things, learn new language, learn music. Recently, I tried to join. I told because I participated only one day in a Rabindra Sangeet class with a team of CR Park. You know, we Bengali people we like Rabindra Sangeet. I tried to join. I participated for one day training, but I was happy and surprised to see that most of the participant of that online learning process of Rabindra Sangeet was Bengali elderly lady. So I like that, and even my teacher was 60 plus. So try to learn new things. Then financial health, you have to be very, very intelligent. You are already intelligent, but sometimes emotion overpower intelligence, you know. So be very careful. You understood that during COVID, the importance of money handling by yourself and your independence towards your money. So be very, very careful. Financially, you have to be independent, then only people will care for you. This is a very, very basic funda. Whatever philosophy I say, whatever I say, this country is like joint family. Even I'm taking care of my parents. I can say I'm a proud son that way. But I'm lucky that my parents are also adjusting and staying with me and my family. So that is a great thing. My parents are with me, and I will probably, God willing, I'll take care till the last day for them. But every parents are not that lucky. Every children are not that lucky. So even if you are staying alone, you have to be financially independent. In this juncture, I will say we are from Healthy Aging India. We are starting a uh, senior abroad residential accommodation from this month itself. It's a very, very, very cheap model and a cheap and affordable and sustainable model. So you can come and stay there. I'll share with, I think Madam will share with you that. I'll share with her. So fourth thing is spiritual health. Spiritual health again. Spirituality has been created by us. If even if we don't able to see God in our lifetime, spirituality gives us happiness. If it is not giving you happiness, then we don't practice, isn't it? So do that. That has definite role, and practice as per your wish. So I think I have summarized a small way. But yes, you if you are not vaccinated, you have to take vaccine. Vaccine is a must. But please, please, please continue COVID appropriate behavior. I was vaccinated. I had a good amount of titer. I was vaccinated twice. I had good amount of titer. Still, I had COVID end of April, and it was really, I'll say, bad COVID. I had lung changes, and I think I survived only because of blessings of many people like you, whom I have tried to serve. Now, my topic. If you if you read it's not book. Polypharmacy is something you will not listen from any other people or any other doctor that way. That polypharmacy is also one form of disease. Polypharmacy means taking more than 5 pills. So I'm sure many of the listeners who are here, either you or your near and dear one are taking more than 5 pills. You will say in this book, I have given an example of a lady who had hypertension, high blood pressure, high blood sugar, coronary artery disease, osteoarthritis knee, which is very, very, very common with aging. Knee joint get, the space get reduced. There is erosion. Then osteoporosis, weakness of muscle, knee, bone, peripheral neuropathy. Most of the diabetic patients, they develop peripheral neuropathy. That means numbness and pain breaking sensation of the foot. Then depression. If someone has 4 or 5 disease for a long time, automatically secondary depression is very common. Plus, there are many issues, many reasons to be depressed. Even COVID has made many elderly people depressed, socially isolated, lonely. These are every topic is a matter of discussion. One days it will take. Then sleeplessness. So this lady, Kamla Sarkar, in the story I have mentioned. There are two terms in elderly. One is polypharmacy, another is multimorbidity. Means for a young population, either they have pressure or sugar, but in elderly they have pressure, they have sugar, they have knee pain, they have forgetfulness, they have depression, they have sleeplessness. For male, they have prostate problem. So all these problems are there. And what is our usual culture, especially in metropolis? We understand organ specific doctor. If I tell you, maybe if Monanita madam would have introduced in front of you with a cardiologist, you would have felt better. Oh, a cardiologist, a neurologist, right? So you have blood pressure, you will go to a cardiologist. You have blood sugar, you will go to an endocrinologist. You have knee pain, you will go to orthopedic surgeon. You have sleep problem, you will go to a psychiatrist. So 4 doctors. This also I told very less. I have high respect for them. We need their support in this system. But 4 doctor has given you 4 prescription, and these 4 prescription are all different prescription. So come back to this scenario, the book, what Madam explained, and I'm also sharing with you this book, Health and Wellbeing in Late Life. So high blood pressure, she was getting telmisartan. Telmisartan is one medicine, amlodipine and metoprolol to control her blood pressure. For blood sugar, she was on metformin, glimepiride, and pioglitazone. This is real scenario. My book is absolutely all real scenario. There is no story at all because I am not a writer, But yes, I see my patient from my heart, and that has imbibed me to write this book. So then, coronary artery disease, aspirin, ranolazine, atorvastatin. For knee pain, diancerin, paracetamol, ibuprofen. Osteoporosis, Selcal, and vitamin D. Peripheral neuropathy, Pregaba, Triptomar. Depression, sertraline. Sleeplessness, clonazepam. So this lady was getting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 medicines she was getting. And this is not a very rare disease, rare thing, You must have seen this. Maybe many of you are taking 14, 15 medicine. But there is nobody to say, and we have problem. This is a problem of our medical fraternity. We always try to ignore others' prescription. Or we say, okay, jo chal raha hai chalaiye, saath mein ye jod dijiye. So what happened is, when you visited 4 doctor, you have 4 prescription, you will just simply sum up all the medicine and take 16, 17, 18 medicine. And remember, every medicine has side effect, every medicine. And sleeping pill is not a great option for elderly, which are very, very commonly prescribed. Whenever you go and say, Doctor Saab, mujhe taakat ka goli de dijiye, doctor will write a vitamin. Believe me, there is no evidence at all for vitamin in usually healthy individual. Vitamin is only needed when you have deficiency. When you are admitted in hospital, you are not having anything, everything through IV fluid. After that, for sometimes you need vitamin. And especially who eats non-veg, they don't require vitamin at all. But takat ka goli means vitamin. And no takat, no vitamin gives you takat. No vitamins give you strength. Exercise gives you strength. Healthy food gives you strength. Positive thinking gives you strength. Right? So among these 16 drugs, I could curtail her medicine to, I think, 7 or 8 drugs. And that is needed for your health. So the topic we mentioned, polypharmacy in a new normal situation. Now, what happened in COVID? During COVID, most of the elderly patient, they are not visiting hospital. So what they're doing? What are they doing? They are just simply following the same medicine which is going on. In between, they have some teleconsultation with the doctor. Doctor says, okay, you continue. You're fine means you continue. That is a good approach. But with that, you have any small problem, you call a doctor or anybody you know, he or she prescribe one medicine. You immediately add that medicine on top of it. So polypharmacy, you have minimal social isolation, loneliness, or anxiety. Immediately, doctor prescribe you one medicine and you started taking that medicine, which could have been easily solved
by simple interaction with you. Simple interaction, you know. So again, here I forgot to give you a tips. Please talk to one of your grandchildren every day if possible, because young kids has a lot of positive vibe. My nani, who is 80 plus, who stays in a remote place of West Bengal, when she interact with my daughter, who is only 4 years, as I mentioned, she's that way great granddaughter, right? So when my daughter was singing something, some two, three line of a Rabindra Sangeet, my nani started singing. Who always complains that no one is here, you people are selfish, you are staying far away. So I have made this. My mother talks to my nani every day, and frequently my daughter speaks to my nani. So if the grandchildren, wherever they are, whatever busy schedule they have, please talk to them. They may feel bored, they may feel you are wasting their time, whatever it is. Talk to them, encourage them. You have many things to give, because the experience you have, the learning you have, no one, no book can match that, no Google can match that, no social media can match that. You have many story to tell. Still, you have many story to tell, which is actually cannot be audio visual everything. Now the practice is everything is audio visual. No, it is not. So please discuss with your young generation. So, and to prevent to cartel polypharmacy, whenever you go to any, you will not get a geriatrician everywhere, right? If you are from Delhi NCR, anywhere from any part, you please come to AIMS. We are there to help you. We are through our NGO, we are starting a program called Cinegini, where a medical team will visit to your house. That is a good program. We will have 24/7 helpline also. That also will share with you with Madam, maybe another day, another platform. We'll discuss here with you, and that is an opportunity to share and care for you. So 24/7 helpline, where if you are bored, if you are not happy, you have a number to call. So this helpline is not only emergency helpline. You need to talk to a grandchildren, please call us. There is a young kid who is sitting there over phone to help you, to chat with you. That is also missing now. And social isolation, loneliness, anxiety, depression need not to be treated by medicine at this juncture if it is due to COVID related isolation. It can be easily solved by only interaction, only interaction. It may be telephonically, it may be through video call. So, so you have any health issue, contact your doctor. Don't just repeat all, don't do that. And every time you talk to a doctor, you ask, doctor, is this medicine essential for me? If the doctor says yes, then the next question should be, look, doctor, I am having 5 more medicine. Is there any drug interaction with the other 4 or 5 drugs? Doctor will explain you. Let me give you a very small example. Many of you are, I'm sure, taking and years of pantoprazole, omeprazole, or Rantac. Do you know what is the consequence of taking pantoprazole left and right? Pantoprazole causes vitamin B12 deficiency, which is one of the cause of dementia in late life. And dementia is something which is worse than cancer. You must be aware of this. Dementia is worse than cancer, right? And you may question me, Doctor Saab, if I don't take Pantocid, I will have indigestion, gas. Do you know around 40% cases, the study says 60% pantoprazole prescription is not appropriate. And why to say prescription? None of the patient, they come to doctor, they simply go to the medicine counter and ask, give me pantoprazole, give me omeprazole, because all of you are doctors. I have gas, give me pantoprazole. I have gas, give me Digen. This is not practiced. This is not right at all for your health. For every gastritis, it is not that you have an ulcer to heal. Role of pantoprazole is very, very minimum, very, very specific. But you need a doctor who will explain you, who will dare to tell you, Mr. X, you don't require pantoprazole. Ultimately, it will harm you, not the benefit. We overuse sleeping pills, alprazolam. I have started alprazolam 40 years back. I'm continuing. 80 years old man told me that day, who are you to stop the medicine? I told, fine. If you are fine with that medicine, you continue. But I'll definitely tell you this is a harmful drug for you. Lactulose, loose, paid safa. You see an ad and immediately you, uh, I'm absolutely fine to say on record what big shot people, including Amitabh Bachchan and that comedy fellow, is doing is total harm to the society. You have constipation, immediately you saw, acha aaj to ad mein ye dekha, chalo leke aake khate. And you are getting addicted with these kinds of uh, powder and syrup. And I don't know, like how the government allow this. This kinds of people should, this kinds of ads should be banned. You have to. So you also visit a doctor. That I wrote in my book, Constipation. There is a chapter, which is a very, very common thing. For a doctor, when you say I have a chest pain, doctor will be much more bothered with heart problem. Doctor will be bothered for hypertension, diabetes, and your last symptom will be, doctor, I have constipation also. Okay, take this medicine. Do you elaborate your symptom of constipation? Neither doctor asks you nor you elaborate. That is a problem. For every constipation, it cannot be a like trial and error method. Chal raha hai. Pehle I saw with isabgol, then evaqui fiber, then lactulose, then loose, then Dalcolax, then loose plus, lactulose plus, many things. These are all business which we consumer has created. You know what is definition of constipation? If you don't pass motion, even not even 3 days in a week, then it is a constipation. But we feel we have to pass motion every day, and that has to be adequately. Rather, constipation has direct relation with your emotion. If you are happy, if you are walking, if you are taking plenty of vegetables, plenty of water, you cannot have constipation. Even if you are not passing motion for, as I mentioned, weekly 3 days is absolutely fine. But you will not believe me, I know. You read the book, you see internet. So minimum medicine is the priority. So COVID crisis, you are not meeting doctor, you are not interacting doctor face to face, you are not walking. So you have multiple ailment which is joining, and you are adding your medicine which is causing polypharmacy. Do you know one of the major cause of fall in elderly people is polypharmacy? One of the drug which has made you fall? You don't know. So we have to be very, very careful that I should not take more drug. And when a doctor prescribes, please ask the doctor, is this medicine is essential for me? Because if you are 60, the purpose is different. If you are 80, the purpose is different. If you are 90, the purpose is different. We don't, again, I'll give you an example. Someone who is 40 years old, 45 years old, has recent cardiac attack. We write them 3 to 4 prophylactic drugs, including one statin. Statin is for cholesterol. So recommendations say, even if your cholesterol is normal, you had some risk factor, you continue statin. But do you know at the age of 80, at the age of 70, cholesterol, cholesterol lowering drug, statin, causes myopathy, weakness of your muscle, leg muscle. So now you tell me, if you are a gentleman of 80 years, for you, what is important, to save your heart or not to walk? You are depending, or you are every time you're feeling, oh, I cannot walk, I have so much pain, I'm feeling so tired. Then you visit a doctor, you say, doctor, I am feeling weak. Doctor gives you a vitamin, which is of no use. Statin may cause myopathy, that is pain and weakness of the muscle. Sarcopenia is something like weakness of muscle, which is very, very common. So how to prevent sarcopenia? You have to take more protein, nor medicine. You have to exercise more, nor medicine. These are non-pharmaceutical therapy. There are small game in the website is available. You can play that game. But most important thing is, I'll stress, is happiness. You have seen the life, you have seen ups and downs of your life. No one is intelligent, wise than you. Be happy, but simultaneously try to learn new things. And COVID crisis, if no one is visiting your house, call them, talk to them, interact with people, especially the young generation. So I think I told a lot. बहुत ज़्यादा बोल दिया. Now I'll hand over the madam. Please.
No, I don't have too
Anybody has
many things.
question?
What about all the supplements that people have taken right through, especially with this COVID thing? Lots of supplements, right? Everybody's hooked onto some supplement, 1, 2, 3, 4, 5. I don't know how many supplements are there. I know that my mother goes around with a curcumin bottle, which I have to have at breakfast every day because it's
See,
put there and then
I
it's
will.
put there back on the table till I have it. Some days I say, no, I'm not going to have it today. I just don't want to have curcumin today. So, yeah.
I will tell all of you here. Anything which is disproportionately more is not helpful for your body, because there is a practice of taking more and more water. Few days back I met one fellow. He told, I drink 9 liter water. I told, how are you surviving? I was surprised. No, I am taking some medicine. I'll not name here. With all, every pathy has their own recognition, uh, goodness or whatever, merits or demerits. But can you imagine 9 liter water per day someone is consuming? He or she will invariably be having low sodium today or tomorrow, because ultimately that water is filtering through your kidney. Why I told water? Because water is life. We called water is life. So even water also, if you drink too much, you will be in trouble. So just you understand my indication, what I want to indicate. Someone told take zinc, someone told take vitamin C, someone told take kara. You are taking it lifelong. No, it was not lifelong. Even zinc, anything more is bad, anything less is bad. So we have to be very, very balanced. Zinc, you took 1 month, 2 months, stop it. Corona is going on for 2 years. Will you continue zinc for 2 years? There is a term called hyper vitaminosis also. You know, vitamin D also nowadays we are getting a lot of patients who have too much of vitamin D in their body. That can also cause this problem. So no supplementation, nothing is better than to have normal diet, normal fluid, normal exercise. Try to be normal. Everything is normal. If you are protecting yourself, if you are behaving, taking care of COVID appropriate things, nothing will happen. और जिसको होना था उनको हो चुका है. But that does not mean we will mingle with in the crowd. Will go without mask. No, you have vaccinated, still you have to wear mask. Mask is a must now, maybe for next 1 year. Social distance is a must now, maybe for 1 year. We don't know, but it's fine. We are without sitting within a feet distance. Someone I don't know, I can still continue my work. We are seeing patient, we are doing everything. Everything is normal for a doctor and engineer and police, whoever in the work in the field. But we are maintaining the social COVID appropriate behavior. So do that. Anybody has question?
Yeah, doctor, I have one question. This PN Murthy here. This you said, a healthy person need not take multivitamin supplements, right? I'm a vegetarian, but actually you see, although we eat almost all the vegetables, which contains the vitamins, but we have to boil it. And, because of pesticide contents, and if we eat raw, then it contains pesticide residues, and, we normally boil it. And by boiling, all the vitamins will not get destroyed.
Yeah.
Only we make fibers only. We'll be eating only fibers.
My point is, you can you just repeat your question?
No, my question is, you said healthy individual need not have to take multivitamin supplements, right? That is a statement you made. Right. My question is, you say I'm a vegetarian. We eat most of the vegetables which contains the essentials vitamins required by the body, but we don't eat raw. We don't eat raw. We boil it. We cook it and eat it. So when once we cook it, will not all the vitamins will not get destroyed, and we'll be eating only the fiber in the vegetable.
You are partially right, sir. But simultaneously, let me tell you, many fruits you eat raw only. Many vegetables also we don't like. We don't even if you are just boiling and preparing the food. I think something is beyond our control. If you consider that oh, there is so much of pesticide. If I eat this, I will die immediately. No, that is also not true, because there is regulatory agency which are working, which are, so all food are poison. If I have to accept that, then there how population aging are growing so fast. How are you growing so fast? So I'm not telling that you never require a vitamin. If you are literate enough, if you are conscious enough, you go for vitamin checkup. What are the vitamins you need? You need vitamin B12. Vegetarians are prone for B12 deficiency. So check your B12. If there is deficiency, you take it. Check your vitamin D. If there is deficiency, you take it. Otherwise, not. We cannot, someone started you a vitamin and you are continuing lifelong. I told that approach should be stopped. You are visiting a doctor and telling doctor, you give me something to strengthen my body, doctor prescribe a vitamin, which is absolutely unscientific. Absolutely unscientific.
I will answer it partly. Even after boiling or cooking the food, some vitamins are destroyed, but then the basic content of the food, and our body has got inside mechanism where they regenerate these vitamins again. So
Right.
it is not necessary that all vitamins get destroyed. I am very clear about Dr. Chatterjee about vitamin B12 for vegetarians. So vegetarians must check their vitamin B12 level regularly, but otherwise vitamins are useless. Occasionally, if you are ill, if you are hospitalized, if you are operated, it's fine, but not routinely.
Thank you, doctor.
I have a
Doctor,
question. I have a question, please. If you are prescribed statins for maybe high triglycerides or cholesterol, how does one then decide that you need not take the statins?
Madam, that is a point I have mentioned. See, when I'll just give you an example. When I see a patient, I'm telling a patient, when I see a patient at the age of 40 or 45, 40 or 45, my target is what is my goal? My goal is that person should survive next 40 years in a good situation, right? So my priority, statin is mostly a preventive drug. But when I see the same patient at the age of 80, suppose I have started for time being, you consider that one doctor is surviving 40 years. He has seen in his early career a patient at the age of 40, 45. So I suppose Ram Babu, I prescribed Ram Babu at his age of 45 a statin to prevent his heart attack. He had a heart attack. He is diabetic, he is hypertensive. Now Ram Babu came to me at the age of 80. He has no more heart attack in his lifetime. 40 years he spent very well. 80 or 85, now his priority is different. At the age of 80 and 85, someone who is coming to me, his or her life expectancy is 5 years. I'm talking you science. Someone may live up to 100 years also. So for him, muscle strength is more important than to prevent a heart attack. You got my point. So muscle strength, someone who is very frail, even if he has a good heart, he cannot do anything, because this will create a vicious cycle. Exercise is the only thing. If you ask me, as a aging specialist, I'll say two things can prevent aging, or I cannot say mortality. Everybody will die, but yes, prolonged lifespan. Two things can do that. One is your exercise. Second is your diet. But exercise comes first. So if I cannot perform exercise, if I cannot walk properly, but I am telling I have to save my heart. I have seen patient who is bedbound, end stage cancer, doctor are still continuing statin and aspirin, telling I will prevent his heart attack. He is counting his days and you are giving him medicine to prevent 10 years, 20 years down the line, heart attack. That is not, so medical science is not a computer science. It's not 2 + 2 4 always. We have to be very, very judicious. So we have to balance between evidence, that means what is written in the book or guideline. We have to see the patient and what is their wish. And we have to take patient on board to decide what should be the treatment. Right. So that is mutually we decide your treatment. And that is not happening because all doctors are busy and all patients are scared of asking question to doctor.
Doctor,
Okay, thank you.
Doctor, are you able to listen to me?
Yeah, sir. Please carry on.
See, you gave an example that some lady was taking 16 tablets and you reduced to 7 or 8, whatever it is.
Yeah,
Okay.
yeah.
Now, suppose similar situation, somebody is there. Now she is seeing cardiologist, diabetologist, so many doctors. Now, whom she will go and approach for reduction of the medicine?
A generalist. If you don't have a geriatrician in your community, you go and visit a internist, medicine specialist के पास आप जाइए, and then you ask him, doctor, please give me what is essential and with minimum side effect medicine. Please summarize my medicine if I tell this way. And that is the reason our subject is growing. You understand, pediatric population needs cardiology treatment sometimes. Pediatric children also need sometimes neurologist opinion. They also need vision problem treatment. But ultimately pediatrician take a call, what are the medicine we should continue finally. So same way, you go to an internist, but gradually geriatrician are also increasing in this country. Now it is very, very less. If you are in Delhi NCR, you are welcome to come to AIIMS.
Yeah, there are very few colleges right now, still now, right, offering geriatric.
Right.
And you were one of the first batches which came out.
Yes, ma'am. I did from Madras Medical College.
Yeah, so that is a problem. See, the other problem is.
So, can you give some reference in Chennai?
Chennai, you can meet, you can go to MMC, Madras Medical College. I did from Madras Medical College. MMC has a Department of Genetic Medicine. You want a private practitioner, then you can go and meet Professor V.S. Natarajan. In Apollo, Chennai, there is a doctor called Dr. Magesh. They're all my friend. Professor V.S. Natarajan is, of course, he's a senior person. He started Department of Genetic Medicine in Madras Medical College. Yeah.
Okay. Thank you.
Doctor, I have another question. Doctor, I have another question. This PN Murthy again. This is regarding the milk. Am I able to hear you? You are able to hear me?
Yeah, absolutely.
This is about the milk, because there are a lot of controversy about the milk. See, milk is the good source of protein as well as calcium. That's what we normally consume, and we have been taking it. But nowadays they say milk, it increases the tendency to become diabetic. It increases the insulin resistance, because most of the milk are A1 milk, and we are supposed to drink A2 milk. And all the dairy milk are A1 milk.
Sir, tell me what is your age?
Opinion of that?
Sir, tell me what is your age? 70.
70.
Are you a diabetic?
Yeah, I'm borderline diabetic.
Sir, what is borderline diabetic? This is a business, The term borderline diabetes, early diabetes, pre-diabetes, I'm sorry to say that, but this is a business by few community endocrinologists and businessmen to catch you, to get some fees from you and force you to get treatment. Sir, if you have survived up to 70 years without diabetic, with having the normal milk, whatever is available in the market, see, as I mentioned you, if I tell you, do you know pollution has effect on dementia? Pollution will precipitate dementia. If I tell these things, can we survive then? Delhi is one of the most polluted area when I am living. Then you should only go and stay in a hilly area where with minimum people, with minimum facility, right? But I'm not going to change that. Have whatever is available. Again, A1, A2, these are all business. Why people are selling, how people are selling so much of vitamin? I'm sure vitamin making company will be my number one. I will be their number one enemy, the way I'm telling it to you, right? Similarly, A1, A2. See, point is very simple. Milk contains good quality protein. You take that milk. And again, you have to believe in our regulatory system. It may have flaws, then though we should not live in this country. There are definite food regulatory system who assess intermittently what is the quality of milk, quality of food, everything is assessed. There will be still some amount of intoxication, but with that also we are living long, and I wish and pray you live 100 years without diabetes. Have normal milk, whatever available to you.
Thank you, doctor. Yeah. Thank you.
Actually, and even milk, you get organic, right? You can, even all the vegetables are organic. If you want to get those, I mean, if you're very, concerned about pesticides in food and pesticides in
One
our
question, sir.
masala, we can get organic.
Ma'am, organic is also a business.
Of course. Of
Sir,
course,
one
and it
question.
costs twice more. If somebody has a question.
Sir, how to avoid thyroxine tablet?
No, if you have thyroid, you have to take thyroxine. And see, again, point is very simple. I didn't tell in my description anywhere that reduce or stop your insulin. I didn't tell that. Someone who has insulin deficiency, you have to take insulin. So someone who has thyroxine deficiency, you have to replace that. But yes, a good news to tell you, I have seen good number of patients where, see, you have to understand one thing: thyroid problem, diabetes, rheumatoid arthritis. This we called as autoimmune disease. So once you autoimmune disease. So again, studies have shown diabetic become non-diabetic with lifestyle modification. And honestly, how many of you practice exercise religiously? How many of you?
I do 1.5 hour.
I do.
Exercise and pranayam also.
It's really great if you're doing it, but believe me, I almost promised to my God the day I was getting discharged from after Corona that I will be the most religious practitioner of exercise, because only exercise and exercise and exercise can improve your immune system. You have heard a lot about immune booster, this take that, immunity will save you. Yes, but immune system can be boosted only and only by exercise. But now again I become irregular. So there is a psychology of exercise. I'm planning to write a book on that. Psychology of exercise, it's very easy to preach, it's very easy to say, but when I have multiple work, immediately I'll just first thing to skip is exercise.
Yeah.
Weekly 1-2 days
Do that.
maybe,
Yeah.
but 5 days I am doing.
Great, do that. I can just give you a very simple rule of thumb about exercise. 30 minutes exercise 5 days in a week is good for you. 30 minutes exercise, but that 30 minutes exercise should comprises of walking, resistive training, stretching or yoga, and balance training. 4 exercise should include. Balance training is you just stand, hold the door, stand in one leg. That is balance training exercise. Simple. There are many things I can share later. Resistive training exercise is you lift 1 kg salt pack, you lift it, do it in your biceps, in your leg muscle, or TheraBender also available. So for that, I think Madam will organize a physiotherapy session. I'll supply that and let Madam organize a physiotherapy session. What are the bare minimum exercise which you can perform at home with no, you should not be biased. And I'm not biased. Even if I'm telling you, you do yoga, but yoga mein, what are the things you should do? I'm not the expert for that, right? But yes, walking, as I mentioned, walking is something for need. You don't require any prescription. And those who are not exercising, start low, go slow, go stepwise. Because there are many people who died after COVID crisis, including you must have heard that Indigo, that fellow Mr. Bhatia, who died of cardiac arrest, who was doing a lot of exercise after COVID recovery. So we have to be very, very careful on that.
I
Sir,
wanted
I
to
have two
ask
questions.
about
Very
calcium.
simple question.
Yeah, I think Krishna Kumar Sai sir will ask question. Let me introduce him. He is one of
Yeah.
our teacher. You know, madam, we teach underprivileged children. Namaste, sir. Underprivileged children by elderly people. And that is a model I give lot of stress. That is called intergenerational learning.
Yeah.
I must write a book on intergenerational learning, provided you people support us, sir. So Sahai
Thank
sir
you.
is joining us from Ranchi. Sir, tell me, what is your question?
सर माय क्वेश्चन इज फर्स्ट क्वेश्चन, हमारी वाइफ को अप्रैल में कोविड हो गया था. नाउ फाइव मेंबर्स को कोविड हो गया था. हाँ, लेकिन दैट टाइम आई वाज फ्री और मैंने लुक आफ्टर किया, दे रिकवर्ड सर. अभी सेकेंड इंजेक्शन जो हमारी वाइफ को लगा सर, हाँ, उसी दिन थ्रॉट, सोर थ्रॉट, सर्दी हो गया, बॉडी एक हो गया. हाँ, तो हमने सीजीएचएस के वेरी गुड फ्रेंड डॉक्टर उनको कंसल्ट किए, तो बोले कि नो नीड ऑफ मेडिसिन, इफ रिक्वायर यू गिव हिम वो सर एलेग्रा. तो मैंने दिया नहीं. तो नाउ शी इज रिकवरिंग slow and slow. She became very weak, sir, after taking second injection of COVID, sir. So what do you suggest at this juncture, sir?
Have good diet, plenty of water, and wait for the time, because COVID, one of the side effect or complication of post-COVID syndrome is prolonged weakness. That weakness will not go with vitamin. Again, I am stressing.
No, sir, no vitamin, sir.
Time, but support her, give high protein content food you give, because muscle involvement is another symptom. And to all of you, COVID causes COVID causes gastro mucosal erosion.
Yes,
you
sir.
have heard in between about lot of fungal infection. It was through that only. So give some probiotics. Probiotics means card contains probiotic, Yakult बोल के आता है, that is probiotics. Best is to घर में बना हुआ कार्ड आप लीजिए, और दवाई कुछ नहीं चाहिए, धीरे धीरे टाइम के साथ ठीक हो जाएगा. खान पान को ठीक रखिए. अच्छा, someone asked my mail ID. I'll be happy to sharing with you. I like question, and with your question, I will definitely be more empowered. And
sir, second question is that sir, कि my younger brother who is taking, sir, Revital per day he is taking Revital. Will you suggest anything, sir, for him?
क्या सर, आप फिर से बताइए.
सर, हमारा छोटा भाई जस्ट हमसे, he is 67 years old. Revital he is taking per day, sir. Revital.
Stop it. इसमें मैं एक I'll just joke only. Don't take it seriously. अब देखिए, रिवाइटल का पहले ऐड करता था युवराज सिंह.
अच्छा.
फिर उनको कैंसर हो गया, उन्होंने बंद कर दिया रिवाइटल लेना.
अच्छा.
उसके बाद ऐड कर रहे. नहीं, आई एम नॉट टेलिंग कैंसर उसके लिए हुआ था. इट इज अ क्रोनोलॉजी ओनली. इट्स अ जोक, इट्स नॉट सीरियस. देन नाउ
व्हाट डू यू सजेस्ट, सर?
Salman Khan started campaigning for Revital. So don't go for that. As I mentioned you, that you need only proper diet. Focus on your diet. And Ranchi has a lot of good organic farming and everything there. So I have shared with you, all of you, my mail ID. And
yes, sir.
So any question you can send me a mail.
Yes, sir. अभी सर मैं 6 months से मेडिटेशन कर रहा हूँ सर.
वेरी गुड.
और सर 5 कोर्सेस कर लिया. बच्चों को क्लास में मेडिटेशन में से पहले 5 मिनट्स या 2 मिनट्स मेडिटेशन करवा करके ही क्लास लेता हूँ. और सर कोविड जब खुलेगा तो नॉट एज ए टीचर ऑफ सोशल साइंस, बट एज ए टीचर ऑफ meditation, I will go to all schools and per day, sir, class. Thank you, sir. Lord, sir, salutations and great salutations.
Thank you, sir. Thank you,
sir.
I wanted to ask something about calcium, because they say as you get older, your body doesn't accept calcium or doesn't generate calcium, so we have to take supplements. So for how long? Some people say give a break after taking 1 month or 2 months. I mean, what does one do about calcium? Because especially for women, you may get osteoporosis or something if you don't have calcium in the body.
Absolutely. I think you are Jolly Dasgupta.
No,
that
I'm
was
Marjorie
Marjorie.
Fernandez.
Okay. It's a good question, and I think it is a common question. Remember, the amount of calcium we consume through any of the product you name, like either Cell-Cal or CCM, they contains actually suboptimal level of calcium. You need more than 1,000 milligram calcium per day. But you see the composition there, elemental calcium, one term is written, which is much less. CCM, which is from Glaxo, they contain, I think, 250. Cell-Cal, 500 contains 350, something like that. You just check, I'm not sure. So calcium you have to take. Calcium is needed. Osteoporosis is definitely a factor. After 35, everyone should take calcium. Number one. Number two, calcium has no connection with your kidney stone, which is a absolutely wrong conception. Calcium has no connection with your heart calcification, the heart vessels calcification. So there is no connection on that also. So you can easily continue calcium, but again, you take one calcium and have some milk also. About D3, yes, D3 I would suggest at least in 6 months once you check your vitamin D, because D3, if you are lucky enough to expose your skin to the sun, maybe you have a good balcony, maybe you are close to beach, then it's fine. Then you don't require vitamin D at all. But if you are not, then you need vitamin D. So usually we prescribe vitamin D 60,000 unit monthly once, but you check 6 monthly once. If it is less, you continue. If it is optimum, you wait again after 6 months, you check.
You don't have a combination of calcium and D3, some capsule or whatever?
It is there, but none. They are all inadequate dose. There is no point of taking, inadequate dosing. Someone raised the question of B12. If you are Bengali and Tamilian or Keralite takes non-veg, very less chance that you will have B12 deficiency. But yes, if you have deficiency, you have to take. Initially, during deficiency, we try to give injectable. Then we taper down to tablet format. But again, nothing is more than 6 months to 3 months. 6 weeks to 3 months. 6 weeks to 3 months is the regime. After that, you can easily stop after checking B12.
And calcium you take throughout your life without a break.
Yes. Because as I mentioned, we take very low dose of calcium. If you are taking, let's say, 3 calcium per day, then you will have overload. As I mentioned, you have to have a very balance as per need you take. So actually speaking, for elderly people, only one drug which you have to take is the calcium, nothing else.
500
no drug is essential, no medicine is essential for you. A person can live up to 100 years without taking any medicine except calcium. That also not needed. If you are like Yuvraj Singh, take 2 liter of milk every day, then that is also not needed. But we cannot drink 2 liter of milk per day.
So 500 mg or something they prescribe, that's okay.
Yeah. Perfect.
Once a day.
Once a day. Yes. And you also take milk.
Take milk I'm taking anyway. I like milk. Yeah. There's no problem. Yeah, thank you.
Thanks a lot, Dr. Chatterjee. I think your time is over, right? You must be rushing. Yeah, I know people are calling you saying, come. They say you must be going back to hospital unless you're already in your chamber.
I'm in the hospital only. I'm in my hospital in my room. So I'm without mask. Yeah.
Okay. So any other questions? If not, we will close today. Thanks so much, Dr. Chatterjee, for coming. I'm glad that you finally made it.
Thank you so much.
Because I've been chasing him for months.
Meet you soon, sir. Jaldi milna chahti thi.
Thank you, doctor.
Thank you again, Jaldi. Okay, thank you.
Thank you.
Thank you. And bye-bye, everybody.
Thank you so much.
Thank you, Dr. Chatterjee. That was fantastic.
Thank you.